Can you travel when you're receiving your chemotherapy? Can you go to parties? Can you have fun? Dear friends, I'm Dr. Rajeev VijayaKumar, consultant medical oncologist at BJ's Clinicals Global Hospital, Bangalore. Today we shall discuss about the same topics. Can you have fun during your chemotherapy? Can you actually have a normal life? Normally, you would have heard that after taking chemotherapy, no, don't go anywhere. Be at home, be isolated, just be at home, don't do any other work. Don't stop, don't even go into the next to the, don't clean your room. I will do the cleaning. I will go clean the bathroom before you even enter it. These are common parlances which are used. This is how the care is shown to the cancer patient who's on chemotherapy. What does this do to the cancer patient? He or she starts feeling inept. They start feeling that, oh, I'm useless to my family anymore. I need someone to take care of me. What does this do? This causes a lot of mental stress on these patients. They start losing their self-confidence. Is it actually necessary? Answer is a big no. Now, just for our baseline, before I say it's a big no, we have two different types of cancers. One, we have the blood-related cancers like leukemias and lymphomas, where your immunity itself is hammered because of the tumor itself or because of the disease itself. And then you have diseases like lung, breast cancer, colon cancer, stomach cancer, brain tumors, where the problem does not lie with the immune system. The immunity falls because of the chemotherapy that one receives. So just for us to understand, if you have a leukemia or lymphoma, the chances of immunosuppression are more because your immunity is low due to the disease as well as low due to the treatment. Whereas in a patient with a solid organ cancer like a breast or colon, the immunity becomes low only due to the chemotherapy. When I joined my training at Army Hospital R&R in medical oncology, I was given to believe by many of my peers and think that, patient, ask them to stay isolated, they finish, they take a taxi back home, go home, and then afterwards let them not move around much. But then everything changed. Once from Subrata Park, Delhi, that's the Air Force station next to Army Hospital, there's one group captain Saab who came over and said, "Doctor, I'd like to finish my chemotherapy at 7:30 in the morning till around 10 o'clock. I'm like, all right, sir. Anyway, you have the whole day to yourself. He's like, no, I'm a busy man, doctor. I'm like, okay, so what do you have to do? He's like, I have a meeting with the defense secretary at 12:30. So at the army headquarters. I'm like, okay, but you're having a chemotherapy. He's like, yeah, so what? I've been doing this for the last 3 months. I take my chemotherapy in the morning, then afterwards by 12 o'clock, I get done with it, and I go to army headquarters, finish my work by around 6:30, then come home. What are these people say that you should not travel? I've been doing it for the past 3 months. None of you all have asked me. I have not told you, but now that you're asking me, I'm telling you. Then it hit me really hard. I'm like, oh, these people are actually doing it. Some of us talk about theory. You should not move around. You should not do this. You should not do that. This person became my role anchor. I started discussing with him what and all he does. He says, I have an office job. Although I have to meet people, I wear a mask. Go ahead and carry on with my activities. Doctor, I'm a very important person in the forces. I can't afford to sit at home. Just after this, I also saw our late defense minister, Shri Manohar Parrikar, carcinoma esophagus. He was on therapy. Most of us did not know that he was in therapy. And finally, just before he passed away, he came to the parliament with a rice tube up his nose. These are very big role models for all patients. Having chemotherapy or cancer therapy does not mean lack of a social life. All of y'all can go ahead. Of course, you have to do it in a very small proportion, but do socialize. When you meet with your peers, when you meet with your office staff, you will realize that your life is normal. Cancer is just a part of your life. It is not the center. Never make cancer the center of your life. It is only a part of your life, and that is only for a short period of time. Once that is done, you emerge victorious and you become a winner. Socializing is a big yes, but nevertheless, caution my friends. Let us take the necessary precautions. Wear a mask, ensure that you have clean hands, wash them. Don't, not like in the COVID times, keep washing. Like I said, now every 15 minutes wash your hand. That will just only lead to atopic dermatitis to your skin. Ensure that you're clean. Ensure you have good hygienic food. Many of my patients, they come, take chemotherapy. Afternoon show, they go for matinee show, see a movie, eat popcorn, have ice cream, and then afterwards head back home. We finish our chemotherapy fast, gives them extra that 3 hours to ensure that they can go enjoy themselves. They come in pairs. 2 patients would come, both would get the chemotherapy, go enjoy themselves, and then after then go back home to their respective houses. So you should be careful. You should use your common sense. There's nothing that can replace common sense. That's a given thing. But apart from that, ensure that you wear a mask, and when you don't go to too many crowded places, don't go to Kumbh Mela for all you want. You can go to temple. You can go. Recently, one of my patients with stage 4 lung cancer, he was breathless. He had a lot of bony pain because he had a lot of bony meds. He finished 3 cycles of chemotherapy. He was fit. I asked him, sir, how are you going about? He's like, doctor, I am a panchayati president. I have to go and finish up all the tussles and problems in my village. Then he sent me a video on WhatsApp. I see he's climbed up the whole hill to Sabrimala. He spent his time. He came and gave me prasadam also. I was very, very happy. So after then, he became my new sheet anchor, saying that, okay, if you think socializing, going out is a problem, well, contact Mr. Shankar. He's going to be a role model from now on. Well, with this, dear friends, again, socializing is a big yes, done with a little bit of caution. Signing off, your friendly neighborhood medical oncologist, Dr. Rajeev VijayaKumar. If you like this video, please do share and press the subscribe button. Thank you.